Hello, welcome to this video. My name is Hannah. I'm a UK registered nurse, a university lecturer, and I've been an NMC OSCE programme lead. And I share on this channel my advice, teaching and demonstrations to help you self-study and pass your NMC OSCE exam for free. In this video, I'm going to do a full verbalisation of the community assessment scenario. So we're going to go through the whole assessment scenario, your APIE assessment, your News 2 documentation, and looking at that important must score that we need to do and complete in the station and the holistic assessment. Remember, the key to OSCE is your high level of verbalisation throughout. That is why I do these videos, so you're really clear on what you need to be doing and what you need to be verbalising for your OSCE exam. Okay, remember you've got 20 minutes for the station. The time goes really quickly, so you want to be systematic, structured, and you want to focus on the important parts and getting the station done, and don't put in any unnecessary practice, otherwise you will be at risk of running out of time. So just a reminder, the community assessment scenario is normally set in a patient's home, and there's can be history of diabetes, could be type 1 diabetes, type 2 diabetes. So we're thinking about those type of areas when we go into the station. There's also sometimes a history of weight loss and risk of malnutrition. So those are going to be our key focus areas of this station. Okay, so I'm going to start my time. Read my briefing. So we've been asked to visit Erin. She's recently been discharged from hospital following a urinary tract infection. She's also got reduced appetite, recent weight loss, and is having problems maintaining her blood sugar in normal limits. That's my briefing, which I'd be happy with. Time's 8 o'clock. So again, Erin, type 2. She's recently discharged from hospital. She's got reduced mobility due to osteoarthritis in her right knee. She's reported 3-month history of reduced appetite and weight loss. And she's had some significant weight loss there, hasn't she? Over 10 kilos. She reports being low in mood, lacking motivation to cook proper meals, been snacking on junk food. Her blood sugar diary shows her blood sugars have been elevated in the last few months. Okay, she's got type 2 diabetes, high blood pressure, depression, osteoarthritis, and diabetic neuropathy. She lives alone. She's divorced, has no partner, retired seamstress, non-smoker, does not drink alcohol. Again, reduced mobility due to pain in her knee. And her daughter lives abroad in Australia. Okay, medications, metformin, losartan, paracetamol, glycoside, and no allergies. Okay, so I'm going to check that it's safe to approach my patient's home. I'm going to decontaminate my hands using the World Health Organization 7 steps, so palm to palm, palm or back of hands, fingers interlocked, palm to palm, fingers interlocked, thumbs, fingertips, wrists, and allowed to drive. Would knock on my patient's door and introduce myself as the nurse and that I can come in. I'm going to ensure privacy and dignity. So Erin, hi, my name is Hannah. I'm one of the nurses working with the community nursing team from your GP surgery, and I've come to visit you today following your recent discharge from hospital. And I understand there's been some concerns around your weight loss and management of your blood sugar levels. So I'm going to do a full APIE assessment, and I'm going to ask you some further questions around your nutrition and your blood sugar control and kind of health and social care. Do you consent for me to go ahead with that? Okay, thank you. So, Erin, I just want to do your ID and allergy check before I go any further. So can you tell me your full name and date of birth? Okay, so in the community settings, there's no wristbands. I'm going to check that against my documentation. So thank you. I've got Erin Thomas, 26th of the 9th, 1947. Can you confirm your address for me? Okay, thank you. So I've got 14 Newhouse Lane, Plymouth. So I can confirm I'm with the right patient here. And do you have any allergies at all, Erin? No allergies. Okay, I can see that's documented on my notes here as well. So that's great. And before I start this assessment, are you comfortable? Do you need anything? Have you got any pain? No. Okay, so I'm going to start with my APIE assessment, Erin. So I can see that you've been talking to me and that your airway is clear and open and patent, and there's no signs of visual obstruction. I'm going to then move on to my I'm going to move on to breathing and do a respiratory assessment. So Erin, I'm just going to be quiet and just going to do some observations. I just want you just to not talk to me and just carry on as you are. Okay, so examine, I'm going to be recording the respiratory rate during this 60 seconds. So my 60 seconds starts now. Okay. You'll need to wait your full 60 seconds, but I'm going to move on for the purposes of engagement and YouTube. But remember, you need to do your full 60 seconds. So after that, I'm going to verbalise my findings. So Erin, your respiratory rate was 16. I could confirm that it was regular and the depth was normal. And I couldn't see that. So Erin, I confirm that respiratory rate is 16. That the depth was normal, taking normal size breaths, and the rhythm was regular. I couldn't see any signs of respiratory distress, so you had no use of accessory muscles, no seesaw breathing, there was no sweating, no cyanosis. I couldn't hear any signs of any respiratory noises, so there's no wheeze, you're not coughing, there's no rattle, there's no stridor, and I saw that you had good equal air entry. So I'm happy with your breathing and your respiratory rates within the normal limits. I'd like to put an oxygen saturation probe onto your finger, if that's okay. Have you got a preference? No, so I'm just going to use this one here, and I can confirm, examine this is clean, there's no nail varnish, and I'm going to pop that one on. Okay, so I'll just let that read for a minute. And so respiratory rates, saturations are 97%, which again is normal. So I'm happy with breathing. I'm going to move on to circulation. So I need to take your pulse, Erin, for a full 60 seconds. So I'm just going to put my fingers on your radial artery in your arm, if that's okay. Okay, thank you. So again, examining my 60 seconds starts now. Again, wait your full 60 seconds. I'm going to move on, but you need to wait your full 60 seconds. So Erin, your pulse was regular. It was 70 beats per minute, which is normal. And again, it was a regular rhythm and the strength was strong. So I'm happy with that. I'd like to take your blood pressure. So I'm going to, have you got a preferred arm? Okay, so we use this right arm then. Have you had any surgery, breast surgery? There's no cannulas in there, I can see. There's no injuries, there's no fistulas. I'm going to go ahead and put the cuff on. So I'm just going to palpate brachial artery and place your cuff 2 to 3 centimetres above that, making sure the cuff's the right size. And you just pop your arm up here on this pillow at heart level. That's going to go up and it's going to be a little bit tight, just keep still. Whilst that is going up, Erin, I'm going to look at your other hand and I'm going to do your capillary refill time. So I'm going to just squeeze your finger for 5 seconds and then I'm just going to check the return of perfusion. Okay, so I'm just going to squeeze your finger 1, 2, 3, 4, 5. 1, 2. So I can see that comes back in 2 seconds under, so that is normal. And I can see that you are warm and well perfused and there's no pallor. My blood pressure is finished now, so my blood pressure is 120/60. So is that normal blood pressure for you, Erin? I can see you normally have some high blood pressure, I think. That's quite normal. Okay, that's good. Thank you. So I've done circulation. I'm happy with that. I'm going on to disability. So I can see that you've been awake and you're obviously talking to me, but I just need to check that you're not confused. So can you just tell me where you are again, Erin? That's right, you're in your house. Perfect. And do you know what the time of day is and the date? Okay, great. So that's right, it's 8 o'clock in the morning and it's the 7th of October. And just tell me your name and date of birth again. Okay, thank you, Erin. So I can confirm that you are alert and not confused. So Erin, have you got any pain at all? I see in your history you've got osteoarthritis in your knees. So on a scale of 0 being no pain and 10 being the worst pain you've experienced, where is your pain level? Okay, so it's not too bad this morning. So just a mild, just 2. Okay, that's good. And you're taking your normal analgesics? Yes, okay, that's great. So, and I just want to ask you about your urine output, if that's okay. Are you passing urine as normal or are you having any problems with your urination? Okay, that's all normal amount. Okay, so I know you've had that urinary tract infection, but you feel your symptoms have settled down and you're not having any pain or burning sensation during your urination? No, okay, that's great. And I also want to just ask, when did you last check your blood glucose and what was it? Okay, so it was 14. Okay, so that is a little bit high. And I know from your notes you've been having some problems with that. So I'm going to, after this A2E, I'm going to come back and ask you some more questions on your blood sugar control. Okay, is that pre-meal or post-meal? Okay, so that's post your breakfast this morning. Okay, so I've done everything in disability, so I'm going to go on for exposure. So I'm going to take your temperature with this thermometer. I'm just going to hold it in front of your head. Going to beep, the forehead's clean and there's nothing obstructing that. And your temperature is 36, so that is fine, and again within normal, which is good considering you've had that infection. And have you got any rashes, bruises, bleeding, or any injuries on your body at all, Erin? No. Okay, thank you. And I just want to confirm your past medical history, if that is okay. So I can see that you're type 2 diabetic, you have high blood pressure and depression, osteoarthritis and diabetic neuropathy, and you've obviously just had this recent urinary tract infection. Is there any other past medical history I need to be aware of? No. Okay. Thank you so much, Erin. That's my A2 assessment done. I'm just going to finish off my documentation. I'm going to come back and ask you some further questions on some aspects of your health, if that's okay. Okay, so I'm just going to do my hand hygiene here. And I'm going to take my observations and get my News 2 chart. So I'll put the date in today, the 7th. And I'm going to put the time in, which is on my station time, which was 8 o'clock. And I'm going to document my observations. So my respiratory rate was 16. So again, single dot in the box in the middle of this 15 to 17 box, okay. Oxygen saturations were fine and normal. They were 97. So heart rate, she's on air. My patient's blood pressure was 120/60. I'm just going to go down the chart here. So 120 is the top of this box here, and 60 is the top of this box here. And my blood pressure was pulse, was 70. So that's just at the top of this box here and under the line 71. Patient was alert. So again, dot in the box, remember dot A. And my temperature was 36. So just going to put that there. That is just scoring a 1 there. So my total news score is 1. The temperature's a little bit low, but I'll just check in with Erin on that shortly. So 1, monitoring frequency. So in the community setting, we've scored a 1. So we're in the clinical setting, we scored a 1. We need to follow the News 2 policy in your exams. I'm going to do that 4 to 6 hourly. I'm not going to escalate this because everything's normal and the temperature is just very slightly below normal. So I'm happy with that and that she's safe. I'm going to put my initials. I'm just going to complete this must chart before I go back to my patients. I've got Erin Thomas. I think normally all the details will be filled in here for me, but I'll just double check. And so this has been completed. So we've got BMI score of 0, more than 10% weight loss. She's not acutely unwell because she's at home and she's eating and there's no issues there. So her total must score is 2. I'm going to put the date in today. The time, so our station time 0800, and I'll put my signature in there. Okay. So I'm going to go back to Erin and explain the results of this and my News 2 chart. So Erin, I've done your News 2. You're scoring a 1, and that's just because your temperature is slightly 0.1 of a degree and below what it should be. So I'm not concerned about that. But I just want to check that you're warm enough and you're okay, with your heating and things like that in the house. Okay, that's fine. So I'm gonna, because of that, I'm going to monitor you 4 to 6 hourly. But I don't feel the need to escalate this part to anyone at the moment. And I've also done your must assessment score. So someone had worked this out previously. And so this is your malnutrition universal screening tool. And it does identify that you are at high risk of malnutrition because your score is 2. And that's because you've had quite a lot of recent weight loss. So what I'd like to do is just ask you some more questions around that, if that's okay, Erin, as part of my assessment. So firstly, can you just tell me a little bit about how often you're eating and what type of food you're eating? Okay, so I see from your notes that you've been finding it a little bit difficult to prepare your food and just been snacking on junk food. Yeah, I know that's an easy option, isn't it? Especially when you've been unwell. It's obviously not ideal for your diabetes management, and obviously you've had quite a lot of weight loss with it. So I'd like to refer you to the dietitian, if that's okay, so we can look at supporting you with your nutrition. Do you feel you need some additional support within the home? Maybe we could look at some pre-prepared meals coming in, maybe discussing this through the council or social services. Okay, we can definitely talk about that as well. What I'd like to do, Erin, is for you to keep a food diary and just write down how much you're eating and when. And then when I come back and check, we can review that. Okay, and I see, Erin, that your blood sugars have been quite high as well. Is there anything that you find particularly difficult with your diabetes management that you think might be causing this? Yeah, again, the diet, that will impact on that. And are you just taking your medication as normal as well? Yes, okay. So your blood sugars are high. What I'd like to do is refer you back to your GP for a review of that, and maybe the diabetic specialist nurse. I'd like you to keep a diary of your blood sugars, make sure you're recording them post meal. And I'd also like you to try and follow your diabetic diet as well, but we'll get you some support with that, as I've already said. And have you got any questions around your diabetes that you're finding difficult to manage? No, okay. And they could just be a bit high, you've been a bit unwell, you've had that urinary tract infection. So they might settle down again, once that is cleared, potentially as well. I see, Erin, that you've have got a history of depression and you've been having a bit of a low mood. So I just want to talk to you a little bit more about that and to find out how you're feeling. Do you feel particularly low at the moment? Okay, and do you have any support or anyone nearby that can support you? Yeah, I see your daughter lives in Australia. Would you like me to discuss this with your GP or to make a referral back? And we could look at some support groups or some therapy talking sessions, or to help you with your low mood, or potentially some medication. Okay, yeah, that's definitely something I can do if you're happy with that. And I see that you live by yourself. So how do you manage with your activities of daily living and your reduced mobility? Okay. Do you use any mobility aids? Does that help you? No. Okay. So I could refer you to physiotherapy as well. We could see if we could if there's something that could help with your mobilisation around the home to make those things a little bit easier. And again, if you feel like you need some additional support in the home, we could have a discussion around some additional in-house support with your consent. Okay, so I think that's all I'm going to discuss and got time to discuss today with you, Erin. Have you got any questions or anything before I go? No, okay, thank you so much. So what I'm going to do, Erin, is I'm going to follow up on your dietitian referral. I'm going to ask you to keep the food diary for me and just try and follow your diet as best you can. I'm going to speak to the GP and get them to review your diabetes management, but also the weight loss. Just make sure there's no other underlying causes of that. Continue to take your medication as prescribed and keep a blood sugar diary. And I'll also discuss with your GP around what support we can put in to support your kind of low mood and mental well-being as well. Do you have any questions before I go? No, okay, thank you so much, Erin. I'm going to just double check all my paperwork and then finish with my station by decontaminating my hands. So palm to palm. I think it's interlocked. Okay, and that's the end of my station. I finished early, but remember I needed 2 minutes as well to take into account for my respiratory rate and my pulse as well. So I hope that's helpful for you. Remember, key to OSCE is verbalisation all the way through what you're doing, thinking like a nurse, being like a nurse, and picking up on all those cues to your information you've got, your holistic assessment. Be really thorough with your paperwork and be really systematic. Don't do things that you're not required to do, and ensure you get everything completed within the time. I hope you find that helpful. Please like, share, subscribe my videos if they're helpful and supporting with you at OSCE. Please continue to share your brilliant OSCE success. I absolutely love hearing when you have passed it. It's really great and gives me great motivation to keep going with this channel. Also, if there's videos that you want me to do, pop them in the comments as well, and I shall look at adding those to my list.